Now that you know the treatments for psychogenic mutism, let's talk about the treatments for mixed hearing loss. The approach your doctor takes to treating your mixed hearing loss is determined by the root cause and the extent of your condition. Mixed hearing loss treatment options include hearing aids. These devices amplify sounds, making it easier for individuals with mixed hearing loss to hear and understand speech. Different types and styles of hearing aids are available to accommodate individual needs. The next treatment is assistive listening devices. The terms assistive device or assistive technology can refer to any device that helps a person with hearing loss or a voice, speech, or language disorder to communicate. These terms often refer to devices that help a person to hear or understand what is being said more clearly or to express thoughts more easily. So, what types of assistive devices are available? Health professionals use a variety of names to describe assistive devices. The first one is assistive listening devices, which help amplify the sounds you want to hear, especially where there's a lot of background noises, like the one I mentioned before, which is hearing aids. Next is augmentative and alternative communication devices, which help people with communication disorders to express themselves. These devices can range from a simple picture board to a computer program that synthesizes speech from text. Lastly, alerting devices that connect to a doorbell, telephone, or alarm that emits a loud sound or blinking light to let someone with hearing loss know that an event is taking place. The next treatment for mixed hearing loss is middle ear surgery. Your doctor may perform surgery to correct structural problems in your ears. So, what surgical procedures are used to treat hearing loss? The first one is stapedectomy. Stapedectomy is a surgery often recommended for the treatment of an abnormal growth of bone on or around the stapes, which is the stirrup bone of the middle ear. Stapedectomy involves removal of the stapes bone and replacing it with a prosthesis. The next surgery is called myringotomy. This surgery uses tiny cylinders called ear tubes made from plastic or other materials, which are surgically inserted into the eardrums to provide ventilation and drainage for children who experience chronic ear infections. A small incision is made in the eardrum, fluid behind the eardrum is suctioned out, and the tube is inserted. The last middle ear surgery is called tympanoplasty. Tympanoplasty is surgery to treat ruptured eardrums. If you have a ruptured eardrum, you have a hole in your ear that affects your ability to hear. This hole keeps your eardrum from vibrating, which can affect your hearing. Healthcare providers perform tympanoplasty surgery by accessing your eardrum and patching in the hole. The last treatment for mixed hearing loss is cochlear implants. Cochlear implants are implanted surgically behind the ear and allow those who are profoundly deaf to understand speech and other sounds. Cochlear implants generate an electrical signal that the brain interprets as sound. The implant has an external portion that sits behind the ear, consisting of a microphone, a speech processor, and a transmitter. These work in tandem with the internal components, a receiver, and array of electrodes, which are implanted in the ear by a surgeon.